and welcome to the basic introduction to ICD-10 for the mental health private practice. My name is Kristen Fitzpatrick. I am the owner of KMF Healthcare Billing Solutions, and I am a certified ICD-10 medical coder. Let me tell you a little bit about myself. I have been in the medical billing industry for over 25 years. My educational background are degrees in business management and accounting. I was a medical biller and office manager for over 20 years before starting my own medical billing and consulting business. Before we get started, I need to go over a disclaimer. Every attempt has been made to provide the most correct and current information as possible. You are reminded to check your local insurance carriers and Medicare for any updates or changes with ICD-10. I also have to add that I may also interject my own opinion and personal interpretation. My goal is to provide you with the most useful information without overwhelming you too much with details that may not be necessary in utilizing ICD-10 successfully, especially with mental health. I want to explain and simplify the information as much as possible. Even if you have a small private mental health practice, it is important to understand the basics of ICD-10. Let's go over the history of ICD. And I will give you the condensed version of this. ICD is the International Classification of Diseases. I could give you a whole history lesson on ICD, HIPAA, EHR, but this is just the basic information that you need to know and that I actually find interesting regarding ICD. Feel free to research further on your own. In 1948, ICD was developed by the World Health Organization, also known as WHO. The ICD classification system was designed to compile data on morbidity, which is the rate or frequency of disease, and mortality, which is the rate or frequency of deaths. In simple terms, it was a system adopted to track the population and the rate of death due to what disease. In 1966, the World Health Organization came out with ICD 8th edition. This version was designed to be more useful for the healthcare professionals that actually treat patients. But many healthcare professionals found ICD 8 lacked the detail that was needed for diagnostic indexing. So that brings us to ICD 9th version, and that is what we're currently using today. It replaced ICD 8 in 1979. This version streamlined ICD into the diagnostic indexing system that could be used for reviewing patient records and current medical care. In 1994, WHO adopts ICD-10. In 1995, the United States was to align with WHO and adopt ICD-10, but was delayed. Yes, 1995. And that brings us to 2014, and ICD-10 was delayed once again. ICD-10 compliance is set to be effective October 1st of 2015, and another delay is not expected. If the United States had adopted ICD-10 coding in 1994, I feel it would have been easier to adjust to the system. Practices are inundated with HIPAA, EHR, PQRS, and other compliancy. ICD-10 just feels exhausting and paralyzing to an already overtaxed environment. Another note, if you've implemented electronic health medical records, otherwise known as EHR, and its meaningful use compliancy, then you are familiar with the emphasis on statistical data. This was also the original reasoning behind ICD. Insurance companies have its own agenda for the utilization of ICD in determining its medical coverage. I like to point out this distinction. How is coding with ICD-10 different? ICD-10 codes can be 3 to 7 characters, but for mental health, they are 3 to 6 characters. The 4th, 5th, and 6th characters provide more specific information to the condition. What's the positive of these changes? Not only does the new structure of ICD-10 allow for more specific information, but also increased codes and categories allow for more accurate coding of the patient's diagnosis. I'd love to use this as a basic example. If you take a category, say cat, that could be separated into two categories, wild cat and domestic cat. And then that could even be separated into further categories, like the wild cat could be a panther or a tiger. The domestic cat could be a Siamese cat or a Persian cat. Actually, that list could go on, but it just shows you how you can certainly break down the basic category into so many different subcategories. Let's talk a little bit about DSM versus ICD-10. DSM, the Diagnostic and Statistical Manual for Mental Disorders. Honestly, I am a biller and coder, so I have a very vague understanding of DSM. I know that this publication is geared to the clinician. But what I do know, DSM is not HIPAA compliant, and ICD is the standard for insurance billing purposes. It is my understanding that DSM and ICD should be thought of as companion publications and used together. I also know that even mental health providers, especially MDs, are expected to code the physiological condition or the etiology, the actual cause of the disease or abnormal condition first. There are a lot of code first, code also, and excludes two notations when coding mental health. Ultimately, this means multiple codes are needed. I believe the DSM references to ICD-10 may not be as specific as needed, especially again for MDs billing E&M codes. I would be very cautious. I am curious to see what transpires regarding medical necessity for mental health. I have yet to find a crossover list of biologically based conditions in ICD-10. That is why it is important to code as specific as possible. In my opinion, unspecific codes will not be considered medically necessary for unlimited or continued coverage after the patient's standard mental health coverage has been exhausted. The ICD-10 CM Coding Book. For mental health purposes, there are two sections that I find most important to review. Section 1, Conventions, General Coding Guidelines, and Chapter-Specific Guidelines. This is located in the beginning instructional section of the ICD-10 book. In Chapter 5, Mental, Behavioral, and Neurodevelopmental Disorders. This is the complete chapter dedicated to mental health. Concentrating on these two sections will streamline your understanding of ICD-10, specifically for your specialty. This concludes the basic information to ICD-10 for the mental health private practice.